Hey, everybody, welcome back to the KCHC Pulse podcast, the podcast where we talk about health, wellness, and everything in between. And this is coming straight from the experts at Kinston Community Health Center. I'm your host, Edwin Vasquez, and today we're going to be shining a light on a topic that maybe doesn't get nearly enough talked about, all right? Men's health. And did you know that men are statistically less likely to go to the doctor, more likely to die from preventable conditions, and far less likely to talk about mental health? That's why today's conversation is important. And joining us today, we have Dr. Ricardo Valdivia, a family medicine provider here at our center. And we'll be talking a little bit about, all these different health concerns that involve men.
Mm-hmm.
So let's go ahead and get this started.
Sure.
So Dr. Valdivia, first of all, if you could tell us a little bit about yourself and how you started family medicine.
Well, family medicine for me has been an adventure. I've started really practicing family medicine back in 1996. Yeah, I'm old. I'm a relic. And then I switched to anesthesiology. I did that for like 10 years, got tired of it, went back to my original roots, which were family medicine. So I've been doing family medicine specifically in North Carolina since 2006.
Wow.
So it's been a while, almost 20 years.
Yeah, nice. So what is it that inspired you to go into family medicine?
Well, it's always the thing that I believe people should go into medicine for is to help others, not to make money. Unfortunately, a lot of people have that way of thinking, not me. So I just feel that where I can do more to help the people get better,
Nice.
the best place to be.
Yeah, definitely. Now, do you see like an importance of focusing on men's health?
It's true because I saw a comedian not too long ago, and he was saying that he just entered the drop and die era or zone, which is basically, he says, between 48 and 62, which is almost accurate. We have sudden death syndromes in a lot of these folks, especially in that men population, because typically, as you already mentioned, men don't want to go to the doctor.
Yeah.
Also, when they come to the doctor, they don't tell you all the stuff. That's why I always ask the men to come with a wife, because the wife is the one that, he told you this, he told you that, he didn't say that. And also men tend not to be checked.
Yeah.
And that's, I think, very, it's taking a chance, unnecessary chance, because I found so many cancers. I found so many blood problems, so many issues with people that if they didn't take care of them, they want to have a fatal outcome.
Yeah.
In months. And fortunately, we've been able to turn them around. That's why we have so many sudden deaths.
Yeah.
That's one of the reasons.
Gotcha. So I guess that kind of goes back to, the next question was, why do you think that men are often less likely to visit a doctor? Why is it that?
I don't know. I'm a man myself.
Why are you so hard?
I'm a man myself, and I go to the doctor and because I have to go to my refills. That's the only reason.
Yeah.
And when I go to the doctor, I don't even tell the whole story. My wife has to go with me. Did you tell her that you were having chest pain? Yes, I was having chest pain, but it was. So that's the way things get tested. That's the way things come out. But if you don't talk about it, especially sexual issues, I'm now trying to be more proactive in that, asking the men directly, because apparently, some people have a problem with expressing their sexual problems, men. But typically, if it's another man, they're more open about it. But still, you have to ask that question to the patient.
Yeah.
And I do when I can.
Nice. And I guess, we're talking about these common health issues. What do you think are the most common ones that we see in
Between what age group? 40 and 60s?
Sure, or even younger.
That's the biggest age group of sudden death syndrome.
Okay.
And on that age group, what we see the most is low testosterone, which is a condition that many men fail to recognize. They think, oh, I'm just not getting old. I'm just getting old. It's not true. Low testosterone is a very prevalent problem here in North Carolina, especially because we have our water table contaminated, unfortunately. And so there's many things in the water table that contribute to the decrease in testosterone, and that's normal 40 years onward, but I've seen that decrease is so sharp, and that will affect your mood, that will affect your bones, that will affect your defenses, your heart, everything. That's the most common thing that we see.
Okay. And then what age do you think that men should really start taking serious, like thinking about preventive care, and what does that look like?
30.
30.
30, because in men, for example, in me, high blood pressure started when I was 30 years old. And that's typically the age around where blood pressure starts, cholesterol starts, and all to all the 30-year-olds, including well, not yet, but soon, you're not a spring chicken no more when you're 30, okay? The nice days are gone. Now you become officially an older person. And with older person have problems. So you have to start controlling your cholesterol. You need to start controlling your vitamin D. You need to start controlling your red blood cells, white blood cells. You start ruling out for major diseases, which I do currently, and keep yourself healthy, because that's when you can have a heart attack. And at this age, mostly they're just getting married or just got married. They have small kids, and it's a shame to see a young man pass and leave the family behind.
Definitely. And that, you kind of touched on it too, like what are the essential health screenings that men should be getting, let's say like in their 20s, in their 40s, and their 60s?
Yeah, well, in the 20s, I started at the 20s, I just get a complete checkup and say, dude, you're fine. I don't need to see you for another 10 years unless you have a problem, a cold, or anything else. From 30 years on, I would check cholesterol, vitamin D, testosterone, red blood cells, white blood cells, just a complete checkup to make sure everything is right, because anything can pop up anywhere. And then from 30 onward, just be checking once a year. From 40 to 60, definitely every 6 months.
Okay.
Because that's what, in older people, the problems jump faster and develop faster than a younger person.
Okay.
So for a younger person, between 30 and 40, once a year is fine. From 40 to 60, at least twice a year.
Gotcha. So be more constant on that, constantly checking it.
Yes, because you might not have God forbid, right? You might not have a prostate cancer now, but 6 months later, it starts to show. But if we catch it early, you're going to live fine.
Yeah.
If you don't catch it early, or if you don't catch it at all, you're going to have a very, very miserable death, because it's very painful.
And that kind of, goes into the next question of like the importance of those regular checkups. Even though some men, we say, I feel healthy, I'm fine, I'm strong. Even though we feel like that, we need to be constantly checking ourselves, even though you feel healthy.
Well, one thing is what you feel, and one thing is what's going on in your body. And I always tell the people, oh, I feel great. Well, the blood don't lie.
Yeah.
We're going to check on your blood and confirm that you're great. So that's nice. If you're great, you're doing good, well, excellent. But if there's something going on, you need to fix it now before it gets worse.
Exactly. And then now we're talking a little bit about that too. How do you approach the conversations about prostate and testicular health with?
Well, I just go straight for it. And a lot of people feel that I'm scolding them, and I'm not. I'm just telling them the truth. If we need to check your prostate because you could have prostate cancer. And we need to check your testosterone because it's normal for men 40 and above to have a drop in that, and that will deteriorate your bones, deteriorate your cardiovascular system, your mind, your energy, your health, your muscles, everything.
Yeah.
So I'm just direct in that and tell them.
Straight to it. That's good. Sometimes we need it.
Excuse me?
Sometimes we need it. So now let's talk a little bit about lifestyle and mental health. So
lifestyle and mental health?
Yeah. So lifestyle choices like diet, exercise, smoking, alcohol, how does all of these impact men's long-term health?
Well, if you speak about cigarette and drinking, in the long run, it's going to be negative. It's going to be negative because it's going to take away from your time to exercise.
Yeah.
In other words, in that age group, you should be exercising at least 3 times a week, nonstop. Period. Because that's what's going to keep you healthy for the years to come.
Yeah.
And if you're going to drink and you're going to smoke, your exercise is definitely going to be impaired or non-existent. So that's why I don't like it. Besides the danger itself, the thing that nicotine does to your body, to your lungs, and the things that the alcohol does to your liver, to your kidney, it just makes you look older. You age faster.
Okay.
And also you're more prone to other diseases like diabetes and hypertension.
Okay. And also now we're going into the mental health. It is a huge issue for men, but it's often stigmatized. Like, how do you approach mental well-being, with your...
Usually the question that I start off is, how do you feel?
Yeah.
I would say 80% of the time they give me an honest answer.
Okay.
I feel good, or I don't feel so great. That's why the wife is in the room is important, because she will tell me, no. The other day you were telling me you were feeling depressed and so forth.
Okay.
And I always start on medication because we know now the cause of depression. It's not a secret anymore. Depression is basically an imbalance in the brain's hormones that we can fix easily.
Mm-hmm.
And if you don't fix it, you get depressed and your whole body suffers. It's the same thing. Unfortunately, these are kind of problems that affect your whole system.
Mm-hmm. It starts one place.
If not control.
Yeah, gotcha.
It'd be long to explain the whole body chemistry.
Yeah.
Just trust me when I tell you that it will affect your defenses, it will affect your bones, and it will affect your heart health.
Yeah. Okay. It has that trickle effect. It goes
Yeah,
everywhere.
it does. It does.
Okay. Now, what advice would you give men that feel uncomfortable about opening up and, like about talking about emotional struggles and depression? What would you tell them?
I would say just open up because doctors are like priests. You're gonna tell them your problems and nothing's gonna happen. It's a way to get off your chest, and it's very important for you to be healthy, not only body wise but health wise.
Mentally, yeah.
And it's very simple to fix. I have tons of patients that are now doing excellent just with one little pill a day. Like I said, it's just an imbalance in the brain that is very fixable, very, very affordable.
Okay. So now we know it's just speak up. Don't be close to that. It's okay to talk about it.
Of course, absolutely fine.
Okay. And then we're gonna go talking now into a little bit of the reproductive and sexual health, because that also is another topic that sometimes we as men probably don't want to talk about. So, are there any maybe common misconceptions about men's reproductive health that you see?
Yeah, tons of them.
Okay.
Especially with infertility.
Okay.
For us to give you an example, a lot of couples want to have kids, obviously,
You're famous, doctor.
and a lot of then afterwards I turn it off, and then my alarm don't work, and I don't wake up in the morning. I come home, I come to work late.
We can't have you getting late to work.
I forget to turn it on later. Many times the infertility problem is two.
Okay.
And the lady comes in and we do all the tests and I find nothing, and at the end it was the man because testosterone was low. And I'm just saying what happened, now that I'm a big fan of testosterone. Another example would be like marital situations, the guy or the lady, they're having issues and they're stepping out of bounds and then bring home STDs. That's another one that we see a lot.
Okay. And what should men know about, for example, sexual health as they get older? The older we get, and when should they start bringing up concerns to the provider?
Immediately. Okay. Immediately, because I've seen kids. Well, when I say kids, I mean 18-year-olds, 20-year-olds, 25-year-olds with these kind of problems, and most of them in kids usually psychological. But in older men, it's very important for the health of the family. In other words, the wife, man, couple, then dynamics. So just bring it up and don't be afraid to say it. It's normal, and everybody has it from 40 years onward. It's a normal thing of life. But like everything in medicine is advanced. So there are also little pills that we can give you.
Yeah,
to help that
famous little pill.
Yeah.
Now you've been talking a lot about the wife or the spouse being present and in the room with men. So how important is that support system? Like family, friends.
It's very, very important, and this is not something that I just take out of the hat. You can look it up anywhere. Married men live on average 10 to 20 more years than unmarried men. That's because the wife is behind you.
Keep us in shape. Nice. Now, obviously, the wife plays that really key part in encouraging men to take charge of their health, right? Because if they weren't there, then we could probably start leaving things for later. I'll do it later. I'll go to the doctor later. But they're the ones that kind of keep us in check, right? They're pushing us.
Typically.
Yeah. Nice. Now, have you seen any maybe some barriers that you think prevent men from accessing care? Like, I don't know, something that would limit them from being able to go to their appointments, and how can we overcome those as a community?
Well, I think the main thing that limits some men to go to appointments is interest. And as soon as they understand that they don't have to just die or die in their sleep, that all of that is preventable, I think the sooner the better.
Yeah.
That would increase the presence of men, but also many times the wife, the man wife or man girlfriend, whatever, the couple dynamics are not good, and that also causes detrimental health on both of them. On both of them. So I would advise that to try to maintain a stable household.
Yeah.
With all that's possible these days for that. And another the one that we see in this area in particular is the economics. It's very hard for a guy, especially those guys that work out for themselves, like I used to do, to just take a day off, because the day off means money that you're not going to have in.
Yeah.
So that's another thing that I see as a backup, as a problem that's causing the backup from men presenting to the doctor's office.
So they're so busy working and they can't take a day off.
Oh, they gotta
want
make money.
Yeah. Yeah.
It's like if you don't make money, how do you eat? How do you buy your kids stuff and so forth?
Okay.
So for them, going to doctors, they probably seeing dollars in their head, but they're not thinking ahead. It's like a car. I mean, if you change the oil, if you change your tires, if you rotate your tires, then blah blah blah, you're gonna have a nice car and it's gonna last longer. If you don't take care of none of that, the motor's gonna burst.
Yeah, definitely. And we do work at a community health center. So maybe some of the populations that we serve also. I know they don't have a car. They don't.
That is true.
There's lack of transportation, but they should also know that we do have transportation services. There's certain requirements, but you should be able to get to your appointment. Just because you don't have a car doesn't mean you shouldn't go to your appointment.
I have to say that Kingston Medical Center is a real gem that a lot of people underestimate, because like I said, I've been here in North Carolina almost 20 years, and I have yet to see a place like Kingston Community Health Center that has so many programs to help the patient. Transportation, like you mentioned, social worker that goes to your house. You don't have that anywhere. We have these buses that go out and do health fairs in different places, dental fairs. You're not going to find a better place. And also we have a pharmacy, which gives you medicine at discounted prices. You're not going to find this kind of help anywhere. So make use of what you have, and don't regret later, why didn't I go? Because even if they make you an appointment 4 months out, time flies.
Yeah.
And before you know, you have your appointment, and at least you're doing fine for you and your family.
Yeah, exactly. Very, very good. Very good point there. Now, are there any cultural or generational differences in how men approach?
Yes, there is
healthcare.
There is. The older people, my age and above, that would be like 50s and 60s and 70s, we're very what I've noticed, we're very keen and very much adept to keeping appointments up and our medication at bed. Then you have this big hole, black hole I call it, between 30 and 40, 45. These guys are just living the life, not thinking they're Superman, but they're not. And then the younger population, actually, they come in early. The 18-year-olds, they want to get their blood checked and everything.
Wow.
So there's a difference.
Yeah.
In the understanding of what health is.
Yeah, definitely. So I guess you could say that the younger generation is kind of more aware.
Correct.
Of the importance of health.
I guess the information, right? Because, for example, I grew up without the internet.
Yeah.
My information was the books. They came in the internet. So a lot of these guys, I'm guessing, between 30 and 40s, they didn't grow up with that information or they didn't get it, and just now that they have it, don't look for it. But the younger guys are very keen and ask you questions and want to get tested on this, on that, and the other.
Good. Okay. Well, that's good. Now we're going to go to a little bit of practical advice and maybe takeaways for the people that are watching us. So let's say that one of our viewers has not seen a doctor in years, right? What would be the first step that they need to take today?
That happens all the time. Yeah. I just saw 2 this morning. So just come to the office, make your paperwork, do your paperwork. Your appointment's probably going to be 4 months out because we're busy. But don't worry, just make the appointment, come in, get your blood work, and talk with me or talk with whichever provider sees you that particular day, and get checked. Yeah. That's all you need to do.
Yeah, just stick with it.
Well, like I said, once a year at least for a younger guy, and for the group between 40 and 6 and above, Twice a year.
Twice a year. Okay. Now, what's one small tiny change that men can make today that will have a huge impact on their health, like
Weight loss.
weight loss?
Weight loss. That's another problem that I forgot to mention. Weight loss. We have a crisis in weight, and the weight people think, oh, I'm just big. No, it messes up your whole body like everything else.
Okay.
It will mess up your body in the long run.
Yeah.
Diabetes, hypertension, stroke, heart attack.
All right. Well, guys, you heard it from Dr. Valdivia. We have to lose weight. So
Yes. Yes.
now, are there any resources, like maybe apps, websites, books that you would recommend for men who want to take a more proactive role in their health?
Well, the American Medical Association has many websites. Everything now is website. Books are like I haven't read a book in a while. So there are many websites. The American Health. Another one is the American Academy of Family Physicians, AAFP. They also have very good article on men's health that you can read at any time for free.
Okay. Nice. We'll make sure to add those links in there so that people can reference it too.
Yeah, of course.
Nice.
Send you the website.
Okay, perfect. And we'll add that to the link as well, to the video description. Now, any final message or like a call to action for all, the men out there that are listening or they're watching us?
Yes. My fellow men, go to the doctor, get checked, and you'll be fine.
Make sure
Because if you don't get checked, things can go south real bad, and you repent yourself. And once it's over, the ship sailed, it's too late.
It's too late. Yeah. Well, guys, that basically wraps up our men's health episode. Again, thank you so much, Dr. Valdivia, for taking time from your schedule. I know you were rushing here, but we were able to make it happen.
Well, you owe me lunch.
We'll schedule that. But again, remember, men's health isn't just about reacting to problems, right? It's prevention, it's regular checkups, and of course, sometimes we got to talk about things that maybe we'll feel uncomfortable about talking. Right?
Yes. Just get out there and say it. Don't have any.
Yeah. Don't be shy.
Exactly.
Don't be ashamed. It's okay. Nothing's gonna happen. If you haven't seen your provider in a while, make sure you look for those signs. Go ahead and schedule your appointment. Mm-hmm. Like Dr. Valdivia said, Kinston Community Health Center will be glad to help you with that. We could just come in.
We have a lot of helps.
Yeah.
Even with your medication, if you can't afford your medication, we also can help you with that.
Yeah.
If you need it, hopefully not.
Exactly. So again, just come in, guys, and or wherever you're at, just go in and go see your doctor, because it is very important. We'll add all the resources, for more information, for links and stuff. We'll add all that to the description. But if you enjoyed this episode, make sure you like, you subscribe, leave us a review, and share it with someone that you think might benefit. So other than that, thank you guys so much for listening to the KCHC Pulse podcast, watching us, and stay well, and we'll see you guys in the next one.
Bye-bye.
Bye.
Take care.